Howdy. Well, it's good to be back and to chat to you a little bit about our department and some of the impacts that COVID-19 has had on our department. It's quite amazing what our faculty and staff have had to do over the past 2 weeks to overcome some of the issues of converting classes to online, and also kudos to the students for taking on an opportunity to learn online for classes that they did not sign up for. For example, we've converted 39 classes to the online format through the rest of the semester. In addition to that, we've converted 80 lab sections to the online format. That is quite a phenomenal accomplishment for many of these labs that are live animal based and converting them to online format. Nonetheless, that is how we've had to overcome some of the issues associated with teaching, and I'm awfully proud of our faculty, staff, and students for doing it in a very short period of time with as few issues as possible. Nonetheless, some of the questions that we've received in the last couple of weeks is associated with COVID-19. And what I've done is I've asked Dr. Tom Welsh, who's a stress physiologist and immunologist, to help answer some of these questions that we've received. And so I'm going to go through some of those questions and we're going to get some of his responses. The first question that I asked Dr. Welsh was, I know that there's a coronavirus vaccine for cattle. Can you talk about the bovine coronavirus and in general touch on how this may be different or similar to the current COVID-19 virus?
A commercially approved vaccine against bovine coronavirus is available. This vaccine is used in pregnant cows to help promote more antibody protection in the colostrum for their calves to avoid scours. There's also a vaccine that's available for young calves to help protect them against a coronavirus that promotes scours or diarrhea. The vaccine that is used against bovine coronavirus in cattle is a killed version of the virus. This killed version of the virus that's present in the vaccine helps the cow or the calf's own immune system mount an antibody response. It stimulates their immune response to help protect them from acquiring dysentery or diarrhea. Since the bovine coronavirus is sometimes present in calves or older animals that have respiratory disease, it's been suggested perhaps bovine coronavirus contributes to bovine respiratory disease. However, some studies do not find a causal link, so it's still not yet clear if the bovine coronavirus or a slightly altered version of the virus causes respiratory issues, the enteric issues, or the dysentery situation in older cows. With regard to humans, there have been various approaches being underway now to develop a safe vaccine against the coronavirus that causes COVID in humans.
The second question that I asked Dr. Welsh is, can animals such as pets and livestock contract COVID-19?
No, pets and animals do not contract COVID-19, although there was a report that a pet dog from a person who was COVID positive, that the dog did have virus particles. However, on subsequent evaluations, that did not appear to be a persistent situation, and the dog did not experience respiratory problems. There have been some experimental approaches of applying other coronaviruses to pet animals, to cats and dogs, research cats and dogs, and those were experimental conditions, has not been seen in natural conditions where there was a transference of the coronavirus from the human to the pet. However, in the recent news, there was the incidence with a confirmed SARS virus present in a tiger at the Bronx Zoo. So the idea underway, the working hypothesis now is that a caretaker of the tiger was COVID positive person who was actively shedding, and that may have transmitted the virus to the tiger and some other big cats who were experiencing respiratory issues. So one animal was sedated and sampled and did turn out to be positive. So that's something novel and new. Although this is novel and new, that the tiger in the Bronx Zoo appeared to be positive for the virus that is promoting COVID-19 in humans, the USDA and the CDC do not think this is anything more than a rare instance. And it also prompts us to remember that we need to have adherence to good hygiene procedures. And this is the foundation for biosecurity to protect ourselves, our staff, and our animals.
If you are ill, can you still care for your pets and livestock? Should you change how you interact with them?
The AVMA, the CDC, and all state and local government health agencies are advising persons who are ill with COVID or suspect that they're ill with COVID that they should turn the care of their animals over to others who are COVID-free. And when working with the animals, one should be wearing a mask to avoid shedding to the animals if you must continue to work with your animals, if you do not have someone else to assist you or to take over that responsibility. Recall that the prior outbreaks of corona-based respiratory disease in humans were related to animal vectors other than cattle. Virologists continue to state that humans are safe from livestock-derived coronavirus. But the question that some have is, could I spread the virus to my livestock or to my animals? The answer is no. Keeping in mind that one instance that was now considered to be very rare circumstance where the tiger in the Bronx Zoo appears to have contracted the virus from its caretaker, who was COVID positive.
So with that, I hope that Dr. Welsh's responses are useful and can help you as you try and understand the challenges associated with COVID-19. Again, we certainly appreciate how our faculty, staff, and students have overcome the challenges associated with COVID-19, and we certainly appreciate all of the support that we received from both our alumni and friends around the state and around the country. Thank you.